So I just want to give a few brief updates. These aren't certainly not a comprehensive list of funding and programs happening, but some key updates since we last met at the forum a number of months ago. We are working together to really connect these programs, the funding, the resources, the staff, so that we can deliver safe, equitable care. And we know a number of hospitals are participating in at least one initiative, some with a focus in their well baby units or NICUs, others with a focus in the labor and delivery department, and really working with our partners here today, including all of you, to really connect that work, like I mentioned, clinically to the communities that we're providing care for, and work with them to deliver the best, safe, equitable care. And so a brief update on our CDC funding, so the Centers for Disease Control and Prevention. We had a $50,000 supplemental fund that we were awarded, and that will be ending in September at the end of the month. We were focused on increasing the number of waiver trained providers. And so we're looking at creative ways. We had some additional funding from the Department of Office of Behavioral Health to incentivize providers for that training. And now we're looking at creative ways to continue to provide incentives as some of the funding sources are ending or have ended. We also are really continuing to increase the number of hospitals that are participating in CHoSEN Quick. So some of you are new today and may have just joined recently. So working to expand and grow that work across the state. And also to continue to deliver bias and maternity care training. We had our first session hosted by the March of Dimes and are looking for additional funding to continue not only training, but really programmatic work to change the culture as we think about equitable, safe care for all. We also have some HRSA through the Alliance for Innovation on Maternal Health, or AIM program. We have some of that funding that's in place through 2023, and that will help us continue to develop this infrastructure where we can roll out patient safety bundles, really focusing hospitals on improving their care, looking at their protocols, their systems in place, and really diving into different solutions that we can implement to help continue to improve the quality of care that's delivered. And that aligns with some of the hospital programs that our state is driving forward, like our hospital transformation program and our hospital quality improvement project. And so really focusing on substance use and maternal mental health in those areas with those hospitals and engaging their communities. We also are providing implementation to address the issues that were identified in the state's Maternal Mortality Review Committee report. And we're working closely with the Maternal Mortality Prevention Program. And one of the things that you'll hear a little bit more about throughout the day, and we'll be sharing information at the end, ways to get in touch. Some hospitals are now participating in both CHoSEN Quick, focusing first with a primary intervention on substance exposed newborns, and also now joining the Learning Collaborative to focus on screening on admission for delivery of patients in the labor and delivery unit. And so really, again, connecting the work from the prenatal period to the time of delivery, postpartum, and then discharging the postpartum person and infant home. And then we also are working very closely with our leadership of the Maternal Mental Health Collaborative and Framework to really see where there's alignment and overlap in a lot of this work specific to comprehensive screening for substances, mental health, intimate partner violence, social determinants of health, and other things that we can really identify through conversations with clinicians and patients, and then help do brief interventions and referrals for treatment, and then continue to follow up on that care and how our outcomes are improving. So a lot of work happening in this space, and really, really fortunate to be partnered with Illuminate Colorado, the CU School of Medicine, a number of other folks that are here today, you clinicians, folks with lived experience, so that we can continue to expand substance use disorder work in the perinatal space. And we'll continue to look for additional funding and alignment so that we can keep doing more. So again, really want to thank everybody for being here. If you have any questions about any of these particular funding sources or programs, feel free to reach out to us, info@cpcqc.org or Illuminate. We're closely related and can share information across our organizations. And with that, I will turn things over to Jade Woodard, the Executive Director of Illuminate Colorado.
Thank you, Jamie, and good morning, everyone. My gratitude to Ashley and Keisha and all of our family advisory board members. Thank you for your vulnerability, and thank you for helping us to identify ways to be better. These Colorado SEN priorities, I'm going to zoom us all the way up to our 50,000 foot view. So you'll see here that these priorities have all been established for a 2-year time period, 2021 to 2022. They were jointly developed by the Substance Exposed Newborn Steering Committee and the Family Advisory Board. So you'll see that the first one is really around reducing stigma. So the SEN provider education work group will take lead on this one, really implementing strategies around expanding healthcare provider education resources related to substance use and pregnancy, with an emphasis on family leadership and addressing implicit bias. Also addressing this priority will be some of our family advisory board work, and specifically a storytelling project. So you got a sample of that today, and really what we're looking to do is continue to build capacity around storytelling to continue to reduce stigma. We're very thankful for the Family Advisory Board leadership on that priority area. In addition, our second one is around ensuring systems and the people that work within them develop policies and practices to support families. So you'll see warm handoffs and standardized practices here, really addressing inequities as a big component of this priority area. So the CHoSEN Collaborative, as well as a new health project coordination work group, are really at the heart of this one, focusing on continuing to expand this work and support all of you providers that we are so thankful to be engaged in, to continue to strengthen the systems, as Susan mentioned at the beginning, looking all the way into the prenatal and postnatal period, and really acknowledging that that first year of life is so critical in supporting families and getting off onto a really strong start, and the role that you all play in that. Second is the Plans of Safe Care work group, and I know we've spent a lot of time talking about plans of safe care, and we'll get to dive in deep on that this afternoon. But really that Child Abuse Prevention and Treatment Act requirement around ensuring that all families or all babies that were prenatally exposed leave the hospital with a plan of safe care in place. Our third priority is around statewide capacity to align efforts. So first thing we're doing is working on an opioid settlement fund recommendations. So through some of the lawsuits that our Attorney General's office has been leading, there's an opportunity with, well, there are millions of dollars of opioid settlement funds looking to come into our state. And there's an opportunity for us to provide some recommendations around how local communities and counties and regions and our state will be allocating those dollars. And so really working to prepare a menu of options for how those funds could support any of the priorities of this SEN work. We have a policy analysis work group that's also working on this priority, translating translating policy priorities into state level policies as needed, ensuring that we have family voice and that we're connecting with the Maternal Mortality Review Committee recommendations, as well as other opportunities. And then finally, under this one is our data and research advisory work group, which is really focused on the Substance Exposed Newborns Data Linkage Project, including a qualitative study to really continue to build our state's capacity to understand and respond to the situation related to perinatal substance use and the different opportunities ahead of us. And then our final priority is really around our statewide capacity related to fetal alcohol spectrum disorders and supporting impacted families. So the FASD work group continues to function and is really focused on implementing the recommendations from their 2020 FASD report. So big thank you to everyone that participated in this through town halls and through the different meetings and groups. All of this is captured on our new website, which I believe Cassie has put in the chat. And so if you'd like to learn more or get involved, please do. And then I'll also give just a quick policy update. There are several things that are currently in implementation. So in 2020, we passed Senate Bill 28, which really made the changes to the Children's Code related to an infant testing positive at birth. Several of Several of you have participated in some way in the rulemaking related to that. Dr. Bruns and I have served on the rulemaking committee, and then there were several town halls and listening sessions, really looking at how do we operationalize the words in statute to achieve what the intent was. And so looking at things like defining the terms threatened by and affected by in the children's code, so that our child welfare system will be able to uh, respond as intended. In addition, the state is about to launch a plans of safe care rulemaking process to really continue to um, standardize what is expected around plans of safe care, and we'll talk more about that later today. Finally, at Illuminate, we are implementing several different projects related to perinatal substance use. I'll highlight three here. The first is Illuminating Childcare, which some of you may be aware of. It's our childcare program that's on site at substance use disorder treatment facilities. The second is our Circle of Parents in Recovery. We are actively expanding our Circle of Parents groups. And so if anyone is interested in exploring what that would look like at your facility, we have opportunities to do that through the Integrated Care for Women and Babies project, as well as through a regional partnership grant and several other funding mechanisms. And then finally, we continue to implement our Smart Choices Safe Kids program, which is really around education, around safe storage and caregiving for children. And then also our toxicology guide, helping caseworkers and other professionals to understand what toxicology tests really tell you and what they mean and how to interpret that. Finally, deep in the legislative session right now. So a few things that are moving include Senate Bill 21-137, which is the Behavioral Health Recovery Act. This is being run by Senator Pedersen and is really looking to continue to strengthen our state's behavioral health system, both in treatment and recovery. This bill does include multiple different components, including things such as early childhood mental health consultation. The Substance Exposed Newborns Data Linkage Project is included in this bill. And certainly we could, through the policy work group, would be a great place to get involved and learn more about any of these. The next is our birth equity bill package that's been moving. And this one is being led by community-based organizations, including Elephant Circle. I believe I saw Heather on. Thank you for your leadership on this package. This package addresses several different issues, including shackling while giving birth, which I know has been a conversation for a long time across our nation, as well as expansion of Medicaid for the full year following birth. That currently, through some of the coronavirus relief, that expansion of Medicaid through the first year is in place, but it's only temporary. This bill would require the state to seek an amendment to make that a permanent expansion. And then finally, 1021 is around ensuring that our recovery community organizations are actually able to bill Medicaid for peer support professionals. And so really exciting opportunities through these bills and many others moving this session. That's just a quick snapshot, but very, very thankful for all of our partners and our legislators, and look forward to seeing how all of this plays out. And now I think I'll turn it back over to Susan to introduce our keynote.